afternoon. It's noon on the East Coast. I'm Christy Musumeci.
And I'm Bob Kerr. We've got a busy day coming up for you here, a busy hour ahead. We are awaiting an update right now from doctors treating that teenage girl who received the wrong organs in a transplant, the wrong blood type in that transplant. She underwent new surgery today. They're trying to fix it. The surgery's over. She's apparently doing well. We're live in North Carolina with the latest on that, and we're going to talk about her case with a transplant specialist.
Also coming up today, the Bush administration tired of the political dance with Turkey and the showdown with Saddam. Secretary of State Colin Powell says he wants an answer about those bases.
And we want to tell you about an arrest that's 9 years in the making. But is a Florida professor really connected to terrorists? The Justice Department seems to think so. And any minute now, Attorney General John Ashcroft is going to unseal the indictment against him and some others. You're going to see it right here live.
So much happening today, and we have a team of NBC correspondents in place around the globe to bring you the latest on the day's big stories. First, though, we begin in Durham, North Carolina for the latest on the teenage transplant patient, Jessica Santillan. She got out about surgery about 2 hours ago. MSNBC's Donna Gregory starts our coverage outside Duke University Hospital.
17-year-old Jessica Santillan is out of surgery as of 10:15 this morning Eastern Time after what doctors are calling a successful heart-lung transplant, her second in 2 weeks. Jessica received her first transplant here at Duke University Medical Center on February 7th, but since that time her body has been rejecting those organs. They were of the wrong blood type for Jessica. Well, her family is calling this a miracle. Some organs became available overnight and Duke doctors were on hand to retrieve those organs. Her surgery started this morning around 6 o'clock and doctors are calling it a success. Dr. James Jaggers performed both the original surgery February 7th and today's transplant surgery at the family's request. Family spokesperson Mac Mahoney spoke to reporters a few moments ago. Here's the latest on what he has to say.
We have faith in the surgeons. We have faith in Dr. Jaggers as a surgeon. He is the one performing the second operation as well. We feel that there was a grave mistake made. We do not question his skills as a surgeon. You know, we appreciate his efforts in this.
Jessica is in the process of being moved to pediatric intensive care. She is in critical condition, which doctors say is standard for patients who undergo this type of procedure. Duke doctors will hold a news conference at 1:30 Eastern Time. We will be there and bring you the very latest details as soon as they're available. Back to you.
Dr. Matthias Loby is an organ transplant surgeon at Houston's Methodist Hospital, and he is kind enough to join us now to talk about this case. Dr. Loby, thanks for being with us.
Thank you for having me.
First of all, fill us in on what doctors are going to be watching for in Jessica in the next few hours.
Well, of course, first of all, the patient has to be stable after the surgery, and given the very critical situation Jessica was in before the surgery, this will take a while to make a clear judgment whether everything went well and she's stable and strong enough to survive this new surgery.
Now, I understand that she is actually being put on drugs that are going to help her body accept these new organs, but along with that, there's another risk. Can you explain that?
Well, I would assume at this point that the major risk really originates from her general conditions, and I understand that she is quite weakened from the previous course. One should expect that her body will accept this new pair of organs better than the previous ones, of course, and that she is receiving a lot of medication to keep her reaction, her immunoreaction down, which will help to accept this new organ.
Now, Jessica is a type O blood type. I want to quickly just take a look at this for our viewers. The wait time typically for type O blood type like Jessica is 934 days. Doctor, why is it so long? Isn't this type O is the universal donor?
That is correct, and that is actually one of the problems, because you can use an organ of an O1 person to transplant it in any other type, any other blood group type. However, an O person can generally only receive an O type organ. So that means that somebody on the waiting list is competing with everybody else his size and body weight, when he has type O.
Another tricky thing about this whole operation is the type of transplant that she was having, a heart and lung. They had actually 4 to 6 hours was the amount of time to get this operation underway. Is that typical, or would it be different, say, for a liver or kidney transplant?
Well, of course, the time you need for the operation itself is very different between the different organ systems. The more critical issue in this type of surgery, however, is how long the time period is between taking out the organs from the donor and then implanting them, having them perfused again in the recipient. And actually, heart and lung are the organs that have the least capability of tolerate this time span.
Dr. Lobi, doctors at Duke University there are giving her a 50-50 chance. I want to ask you, what's your medical opinion? Is that being generous?
Well, 50% chance is a fair estimate. However, given the very small number of those cases performed worldwide, it's very hard to give any serious prediction on what her survival numbers would be. And of course, in the individual case of the patient, it's always either it works or not.
Of course, we're all hoping for a clean recovery. Our prayers are with that little girl. Dr. Matthias Lobi, we certainly appreciate your joining us. Thank you, sir.
Thank you for having me.
Bob, over to you.
Christy, thank you. And we want to remind our viewers that in just a few minutes we expect to hear from Attorney General Ashcroft